Hello, good afternoon, everybody. I nearly said good morning there. Welcome to another Montfort University live stream. I hope you're all having a lovely day, not necessarily enjoying the weather we're currently having. Hope you're staying safe. And hopefully you'll get some fantastic information today from another one of our fantastic live streams, looking today at the pharmacy department and looking at the frontline fight into COVID-19. My name is Ben and I work part of the marketing team, and today I am joined by a fantastic team of pharmacists and people that have been working on the front line with COVID-19, and they're here today to give us some information about what exactly has been going on and how that fight against COVID-19 has been sort of impacting things like the students and things like the teaching. So it's going to be very interesting to kind of speak to them and find out exactly how that sort of practice and how that sort of influence has been made from the things that they do in their day-to-day, from the academia side of things, from academia into actually working on that front line. And we've also got a third year student joining us on the live stream as well, who is also going to be able to give us a little bit of an insight into how he's found that sort of side of things and how that is going to impact on from his studies as well. So I'm very, very excited to see exactly what is going to happen here on this stream. If you are joining us and you're viewing us on YouTube, do make sure you drop us a little comment, say hi. If you've got any questions throughout the stream, do pop them in there as well, and we will do our best throughout the stream to try and answer some of those. What I'm going to do is I'm going to do a bit of a round of introductions as well, so that you get to meet everybody that is going to be on the stream this afternoon. Again, you won't be stuck with me for the whole hour. What I'm going to do is I'm going to hand over to some experts in this particular field to talk exactly what it has been like to fight COVID-19 on the front lines. I would like to start this stream by introducing the Associate Professor in Pharmacy, Ahmed. Good afternoon, Ahmed. How are you?
I'm fine, thank you, Ben.
So this session that we're going to be running this afternoon, what sort of things can students and people expect?
So we've got some of our community pharmacists and one of our students who are working on the front line, and really it's to try and give you an idea of how things have changed for everyone over the last 3 months, how their working days changed, how their working lives have changed, the challenges they've had, how they've overcome them, and really thinking about COVID-19 going forward and trying to figure out what kind of impact it's going to have on both academia and on pharmacists' working lives.
Absolutely. Thank you very much. So it's going to be very interesting to see how that is impacted for you guys. And obviously it's going to be very interesting to speak to some other people who are going to be able to talk a bit about that. So I'm looking forward to coming back to you, Ahmed, and giving us a bit more of an insight into that. The next person that I would like to introduce in our round of introductions is Simon. Now, Simon, you are currently working away at the minute, aren't you?
I am indeed, yes. I'm in my consultation room at the moment as we speak.
That's very exciting. So what sort of things have you been doing today?
So, I mean, the weather's not, as you said, Ben, the weather's been pretty appalling today. So it's been not a normal day today around here. But usual sort of things. So, you know, I've been helping out. I've had a couple of queries from GPs around what's available with regards to a product called any pharmacy students on, or people wanting to study pharmacy, ranitidine, because that's now discontinued. Took a couple of GP queries around that. You know, dealing with normal prescription queries. Been lots of insect bites today, actually, and nasty ones actually. Yeah, had a few of those. A couple of poorly children. So normal sort of day, really. Every day-to-day stuff. You know. Supporting our local community and being there for them.
Yeah, and Simon, what is it that you do at DMU?
So I've got two jobs. I work for DMU 2 days a week, so that's on a Tuesday and a Wednesday, and I'm a pharmacy manager for Lloyd's Pharmacy the other 3 days. So yeah, my life is pretty busy, Ben, pretty busy.
Sounds like a very busy man. So Simon, if you need to step away to do your actual job at any stage today, but hopefully we can come back to you and have a bit of a chat with you a little bit later on, which sounds really exciting. Okay. And just, again, learn a little bit more about what you're doing for sort of day to day, just to give people a bit of an insight. So yeah, looking forward to coming back to you a little bit later, Simon.
Yeah.
Perfect. Thank you very much. Next on my list and round of introductions, we are also joined by Jyoti. Hello.
Hi, Ben.
So Jyoti, what is it that you do and what have you been doing over the last couple of months?
So like Simon, I'm a pharmacist as well. So I work for Boots, and in the last couple of months, I've just been going around the country setting up the drive-through test centres for COVID-19.
That sounds amazing. And I know quite a few people have been using those centres. So you really are, again, the star of the show a little bit here in terms of setting up those centres around the country, which is fantastic.
Yeah, it's been really rewarding, and hopefully later on we're going to tell you a bit more about what I've actually been doing. And like Simon, I've got 2 jobs. So I work for Boots a couple of days of the week, just predominantly doing like pharmacy training and development with our pre-reg population or our pharmacists in stores, and then the other time I'm at DMU working with Simon and Ahmed on our pharmacy undergraduate programme in the pharmacy practice team. So again, that's really great as well.
That's amazing. Thank you very much. So I think if students were sort of looking out for obviously academics and people that could be teaching them in the future, if they are looking to come to pharmacy at DMU, you've just met 3 potential people that could be marking those examinations and be teaching you in the lab. So it's good to put a bit of a name to a face there.
Definitely.
Lovely stuff. So, and the last person I would like to introduce you to, I've been looking forward to coming back to you a little bit later, Jyoti, and finding out a little bit more about those test centres. The last person that I would like to introduce on my round of introductions, last but certainly not least, he's just run all the way from work. We're joined by Jay. Hello, Jay.
Hi.
So, Jay, what is it that you do and what have you been up to today?
So, I've a 3rd-year pharmacy student, as mentioned, and I am working. I'm working in 3 jobs actually. So I'm working in 2 different local pharmacies, and also I've just started at Boots. So this morning I've just spent the whole time kind of just dispensing. We've gone through the whole day's dispensing already. So yeah, I felt that I was in a position to help when the academic year kind of got suspended. So yeah, that's me.
That's amazing. And again, like I say, it's going to be really lovely to talk to you a little bit later. And again, just find out a little bit more about what you've been doing. And again, how COVID has obviously impacted on perhaps some of your teaching, but also how you've been able to develop some of those real world skills in things like actually working within the pharmacy. So it's going to be absolutely fantastic to come and talk to you a little bit later. So thank you very much, Jay. I'm just going to bring everybody else back into the stream just very, very quickly. Hello, everybody. Now, I have to profess that I am not an expert in pharmacy, hence why I've got these fantastic stars of the show here on the live stream this afternoon. So I'm going to hand over to Ahmed, who's going to give a little bit more of a context behind this session, what students and people can expect from this live stream and the sort of information we can provide. And again, talk a little bit more about the impact that COVID-19 has had on the pharmacy industry. So Ahmed, I'm going to hand over to yourself to carry on with the stream.
Brilliant. So yeah, so that's the first thing that we've all learned is how to unmute a mic and mute a mic, because we all get caught out on mute. So thank you for the opportunity. I think for all of us, if not all of us, definitely the majority of us, life has changed over the last 3 months. And due to obviously COVID-19, the impact on pharmacy has been large and wide. And that's whether you look at academia. So our job, so my job as head of pharmacy practice has changed massively over the last 3 months. We've had to adapt to remote teaching, remote online assessments, but it's had a massive impact on the front line, whether that's community pharmacy, hospital pharmacy, or GP practices as well. I started off a long time ago at Montfort University, working exactly as Simon and Jyoti are. So 2 days a week was at the university, and the other 3 days was actually at the Leicester Infirmary. So that's our local hospital. And we've been lucky over the last 10 years, and hopefully going forward, to have a diverse group of teaching staff on the undergraduate MPharm, but also the amount of teacher practitioners and the quality of teacher practitioners that we've had. The reason we have teacher practitioners is so that they can bring current practice, current knowledge to our students, so that we're teaching the latest things to the students. And that works really well because they bring their everyday knowledge to the students. Now, obviously, come the 18th of March this year, the university decided that we were going to move everything online because of the COVID-19 pandemic. which provided us with lots and lots of challenges. Like I said, in academia and with some of our staff. We're also quite fortunate to have a student body who has really found their community spirit over the last 3 months. And Jay is one of our star students who's been working, like you said, 3 jobs. I didn't know about the third one, but 3 jobs. So on the front line, as well as trying to balance that with their teaching, with being taught, and also with exams and assessments. So I think as a university and as a School of Pharmacy, we decided quite early on that we would allow staff who had recent experience in frontline and in whether it be community or hospital to go back to their frontline jobs if they were needed and if they wanted to do that. We obviously had to keep a few staff. So I was on the list. I was on the reserve list to go back to the hospital where I left 2 years ago. But thankfully they didn't need me. And also we had obviously to make sure that we had assessments ready online. And we're now in the process of thinking about teaching for next year. So like I said, we decided quite early on to let staff and students get the opportunity to help our local community. We've set up databases, and Jay, I'm sure we'll talk about what he's done. He's done a fantastic amount of work setting up databases, trying to match our local pharmacies to students. Obviously, students come from far and wide, and so it wasn't just Leicester pharmacies that were affected. So if you're a student and you've gone back to Manchester, he's put community pharmacies and students in touch, which has been a really good venture. With our staff, so Simon went back to community pharmacy for the full 5 days a week for a few weeks while they were under an enormous amount of pressure. And as Jyoti said, she's been out doing some work with the test centres. And so really, they are the stars of the show. You know, like Jay said, he's been working 3 jobs. Jyoti's been doing 3 jobs, and Simon's been out there on the front line, 5 days a week. It has been a massive challenge from what they've said. They've found solutions to overcome it, and they're doing a fantastic job. I mean, from my point of view, and from an academia perspective, we have had massive challenges in getting things ready for remote teaching, online assessments. Obviously, we kind of knew that possibly it was coming at the beginning of March, but up until the 48 hours before we actually shut down, no one knew what the impact was going to be. So we've had to set up online assessments, make sure that they're robust, make sure they're actually testing students in the way they should be tested, but also making them fair and taking into account the stresses that the students will be under. I mean, some of you out there, especially if you're parents, will have been homeschooling as well as potentially working from home. And I know I've been doing that. I wouldn't want to have an Ofsted inspection, definitely not. But we've all been trying to juggle more than one thing. And for the students, it's trying to make sure that they've got somewhere to work and can actually get on with their work. So a lot of students use the library, and obviously that was out of reach for them. And so we've tried to bear that in mind. And for us now is really thinking about next year and what kind of teaching we're going to have next year. Obviously, we're at the mercy of COVID-19 and the government and the guidelines. So we're talking about social distancing. And as an example, some of our lecture theatres, that hold 300 will now only hold 30 or 40 students with social distancing. So we've got a lot of challenges, but we're working really hard on making sure that the students have the best experience next year. None of it is ideal, but we've got to do the best for ourselves and for the students. But I think I'll move you on to Simon and Jyoti, because I think you want to hear about what they've been doing over the last 3 months.
Absolutely. So I think what we'll do is we'll very quickly jump over to Simon first, and we'll have a quick chat with Simon just to find out a little bit more about what he's been up to. But thank you very much, Ahmed, for giving some really nice context there behind how it's impacted students, how it's been impacted teaching. And I'm sure we get a few more questions about that a little bit later on. So let's move over to talk to Simon. Hello again, Simon.
Hello, Ben, and everybody else. Hello. As it alluded to what I do. So I'm a teacher practitioner at Montfort University. Also, as I said before, work in a community pharmacy as a pharmacy manager. So over the last few months, I've been a pharmacist for a long time, 25 years, something like that. And never have I known anything like what we experienced at the end of March, beginning of April. It was almost like a tsunami of work and customers and demand. just coming through the door every day, every minute, every hour. It was just unbelievable. So that initial challenge and that sudden spike in increased workload was kind of, as I said, unprecedented. Customers, every customer wanted to buy paracetamol. Calpol, you know, a very simple children's medicine with paracetamol, was unavailable for a few weeks. And I'll never forget when I had a mother come in with a poorly child. She'd been to 5 other pharmacies and she couldn't get any paracetamol for her child, and I didn't have any either. And dealing with that was quite obviously distressing for her, but also I felt like I was letting her down. You know, it wasn't my fault, but I felt I was letting her down, and it was really difficult to try and help her. Obviously, I tried to help her the best way I could, but it wasn't easy. So that was the initial challenge, and obviously the prescription volume increased dramatically as well. I mean, in a few weeks we did 50% more prescriptions than we normally would do. The key there is just I used my team, you know, to the best of their ability, and led them in the right way. Because as the leader of my team here, you know, supporting them was massively, because they were stressed. You know, they were worried. You know, encouraging them as well. You know, so why we are here. You know, the biggest reason why we are here and I do my job is for my community that I work in. And I suppose that's one of the things I'd like to get across, is that, you know, over the last 3 months, you know, we've not shut our doors. You know, we've always been there for every single person that wants access in our community. And the patients and our customers have needed us the most in this time, you know, providing the essential healthcare advice, the services and the products that we have continued to provide through them throughout the last 3 months or so. Because from a patient point of view, they might not be closed, but, you know, GPs locked their doors overnight. Now, that wasn't the case in terms of access, but that was how the patients felt. Oh, I can't go and see my doctor. They've shut the door. I can't get in. Was how people were coming to say us, and that also led to quite a lot of angst and anxiety to patients. What do I do if I need to see my doctor? I can't go and see them. So, and there's still an element of that. I'll be honest. You know, patients do still see their GPs closed and they can't go and see them. That is not the case by any stretch of the imagination, but that is still the perception that some patients have. So initially it was about reassuring the patient to make sure you can go and see your doctor if you need to. However, if you don't want to, then this is the advice that I can give you. And also with dentists as well. Now, dentists were shut and you couldn't go and see a dentist. And in some places you still can't go and see a dentist. And I've had people in my pharmacy in tears, in pain, because they got such severe dental pain. And normally what would I do? I'd refer them straight to the dentist. Go and see a dentist today. Go and get an urgent appointment. Go and see them. That is not an option, or hasn't been an option. So we're making sure that we provide them. I provided them. My team provided them with using the arsenal of products and advice and stuff that we can, keeping those available to them. So moving on to some initial challenges, and they're still kind of there. The increased workload is still there around prescription volume, because patients that would normally maybe go to a supermarket pharmacy don't want to go there. Because they have to queue to get in, and they don't like to be in that environment around so many people. Patients who maybe used a dispensing doctor before can't get into the surgery, or again don't want to go in the surgery but feel happier coming to see us. So we're still dealing with that increased volume, which is good for business, don't get me wrong, but it does lead to challenges. But however, what has disappeared for my pharmacy and for every single pharmacy across the country is the services that we used to provide. So just talking for my pharmacy, I used to provide a really successful travel clinic. Obviously that's gone because people aren't traveling. So, you know, giving all sorts of advice on vaccinations, on travel, that's gone. And people, you know, we provide services like MU medicine use reviews. Still can do those in a roundabout sort of way, as long as we do it in the right way. But again, patients don't want to sit in an enclosed room with you, and from my point of view as well, you need to make sure you protect yourself in the right way to do that as well. So yeah, some of the services, so the income we generate from the services has disappeared, and that's a real challenge for us, because we need to make up that income in other ways. And another thing that's a real challenge at the moment is the physical barrier. So normally, you know, if you cast your mind back 6 months, a normal community pharmacy, you'd walk in whenever you liked, you know, it could be as many people in there as you like, you can go and talk to anybody you like. No, it's just like normal, you know. That normal is no longer normal. We're back to the new normal now, which is with screens. So we've got like it's not you can see through it, but a physical screen. You've seen them in supermarkets. We're wearing PPE in front of customers as well, so visors and masks where appropriate, and gloves where appropriate as well. And from a patient point of view, that does make communication to the patient quite difficult, particularly if you've got someone who's hard of hearing. You know, they may not be able to hear you. If they're wearing a mask as well, you can't hear them. And if you think about the type of person you're speaking to as well, to a young child, you know, and I approach them with a visor and a mask on, they're going to be quite scared, you know. So that's an ongoing challenge that I think I was talking to Ahmed about this the other day, about how we do communication skills with our pharmacy students. Is we need to factor in some kind of that kind of thing now to help them be aware from that. And I'm sure Jay, Jay for a minute, he'll pick up on that as well, around how communication to patients is difficult. I mentioned before about I'll just be 2 more minutes, if that's okay, Ben. Just around increase in workload. So obviously everybody wanted their prescription delivered, and being part of the community that we're in, you know, we have really good links in our community. So it was impossible for us to deliver every single prescription that was demanded, every single delivery request. It was just impossible. We couldn't manage that workload. So we had some really good volunteer groups come into us and say they would want to willingly provide their services. We had some real good links with the local churches. You know, it's been really nice to make those links, and you know, and see the patients benefit from other people being able to pick up their prescriptions. So that's a little bit around changes to normal and a bit of challenges. What does the future hold? So that's a tricky one, really. I think in the immediate future, we've got the flu vaccination season coming up, and managing that demand from a community pharmacy point of view is going to be critical, because it's not going to be a problem getting people coming in to have their flu jabs this year. They're going to be queuing and waiting for their flu jabs, and you know, people are going to be anxious about flu and COVID. So that's the immediate future, that will be a massive demand and a massive kind of challenge to deliver the volume that the customers and the patients are demanding of us. And with us community pharmacy, it has been a slightly uncertain future, I'll be honest, over the last few months, after the last few years. We're a little bit more stable now. But hopefully what the COVID-19 has done with the NHS, with the government, is to say that actually pharmacy stepped up to the plate. You know, pharmacies and their teams and pharmacists and their teams have really stepped up to the plate and delivered and continue to deliver that fantastic service that we deliver. And that has been recognised by the NHS and the Department of Health, and hopefully Matt Hancock as well. So hopefully that will lead to a more higher kind of profile for us as part of the NHS, and lead to us delivering more kind of clinical services, which is what we want to do as a profession, you know. And it'll be quite exciting to be part of that change. You know, as I said, I've been a pharmacist for a long time. I think we're going to see more change over the next year or two than we have ever seen. And I suppose finally, for those people thinking of doing pharmacy, I've had a fantastic career. You know, I've had 25 years and I've loved it. And there's so many more opportunities for you guys out there now with a pharmacy degree than there was for me when I qualified many years ago. So yeah, that's a little bit about me, a little bit about what's been going on, and a little about the future. So good luck to you all.
Thank you very much, Simon. That was really painting a picture of what it's like to work in a pharmacy at the minute, I think. And it was almost things that I hadn't even, again, sort of considered overall, that you sort of talked about there, you know, even just the communications with patients and that sort of thing. Just all of these things that have been impacted by this virus, for you to be able to do your sort of day-to-day job, but also for people to live their lives and to get the things that they would normally just be expected to sort of go to a pharmacy and be able to pick up the things they need. So yeah, really, really fantastic insight. There's a question I do want to ask you, just in case we don't get to ask this later, and I think I do want Jyoti to pitch in on this a little bit as well. But you mentioned obviously the consultations and that sort of thing, and obviously there has been a slight increase on that. Do you think that will continue to go up? Do you think that will continue to be the case now that the pressure is on GPs?
So, hopefully, what the COVID thing has done is that the government were all pushing go to your community pharmacist first. That was kind of the message that was coming out. Remember those silly videos they did a few months ago before this all kicked in, and I think that's kind of that has kind of accelerated that. So there is certainly an increase in demand in people thinking about, or do I really need to go and see my doctor for this, or can I go and see somebody else? So there has been that increase, and that will continue. But that's what I'm here for. I love doing that. That's what I'm here for. I'm sure Jyoti will say the same. When customers come to you for some help and you can help them and advise them, that's why we do our job. So yeah, the GPs have reduced their services. That is correct. But yeah, it's been great for us to step up and deliver what we needed to.
Yeah, absolutely. And it sounds like it's been a fantastic, I don't want to say opportunity, but it has been just that, the opportunity for the pharmacists to step up and almost fill that gap where GPs aren't able to during this time. So yeah, absolutely amazing. Thank you so much, Simon. And again, hopefully we can come back to you a little bit later with some more questions if you're still around and you're still with us. So thank you. Right. So next up, what I would like to do is I'd like to jump over to Jyoti, who she'll likely echo some of the things that Simon has just said, but we'll also talk a little bit about her experiences with this sort of COVID-19 sort of testing areas. So Jyoti, over to yourself to talk about your sort of experiences.
Thanks, Ben. So just a little bit more about me. So I, like Simon, have worked in the community. So I've been a pharmacist for 10 years, and 6 years ago is when I came to DMU. So like I said before, work a couple of days on the pharmacy undergraduate course, which is fantastic because you, as Ahmed says, you really get to bring your practice that you would do on a day-to-day basis into the classroom and really helping students from the first year to the fourth year, embedding all those communication skills, learning all about dispensary, thinking about legal, ethical issues that they're going to take through their pre-reg year, but also through their career. So that's been great to use that as well. And like I said, work in the community, the Boots, do that, still work as a pharmacist. And just to echo some of the things that Simon said and that question that was asked, I think, again, flu this year will be absolutely massive. So and it's great that we're in a position to be able to deliver those services to those patients that need them. And I'd say carry on using your pharmacist for all the services that you may require. So what have I been up to in the last 3 months? So I guess my world work really changed 3 months ago when the COVID came and we went into lockdown. So Boots were really fortunate to work alongside with the government to set up these drive-through testing centres for COVID-19. So I was fortunate to be a part of my team within Boots to be able to go and set up those centres. So what that involved was me delivering the training for the testers, so making sure that they really knew how to safely put on their PPE, take it off, accurately be able to take that throat swab and that nasal from a potential person who may have symptoms of COVID-19, so that they could help them get back to work where they really needed them. So in the initial stages, we had it for just NHS frontline workers. So I guess when we look back at March, it was really crucial that anybody that was a doctor or nurse working on that front line could get back to work and provide all those great services that they were doing, treating COVID patients or anyone in hospital at that time. Since then, as you would have seen from the government, the testing's been rolled out to everyone can get a test now if they're showing symptoms for it. So it's been good. It's been really rewarding. It's been nice to be working on the front line, training those testers to get a accurate swab so they can get back to work if that test is negative. And I guess for me, some of the challenges were that my work routine was pretty much 9 to 5, Monday to Friday, either at uni or within Boots with the populations and stuff that I do then. When COVID came along and we're working very much with the government in getting these test sites open, I've been up and down the country for the last however many weeks, 12 weeks that we're talking, and just setting them up. So they could be long days, traveling to London, Milton Keynes, Cambridge, Oxford, wherever they needed a test site centre opening, and doing the great work with our training teams to make sure that it's set up so the public can go and access those test sites and get tested for those things. So I guess the biggest challenge for me has having my work world completely changed. So whereas as Ahmed said, I'm currently doing 3 jobs, and not only just the test sites and setting them up. And like, even after this call, I'm driving to Norwich to set that one up, but also having to still look after like our pre-reg population, and also thinking about for next year and our current students that are at university, like what are we going to do with them and how are we supporting them in this current period, but also thinking about next year. So I guess some of the things for the future for me, I have to think about, well, what does that blending learning approach really look like for a pre-reg who's going to be coming in and accessing our pre-reg programme, thinking about some of the learning materials that I will be doing with responding to symptoms with our students at university, and thinking, well, how can we incorporate that into a blended approach? So that's some of the things that I'm working on in the near future, both with Ahmed and within Boots as well. Again, similar to Simon, I'm still a pharmacist. I still work at weekends, and it's thinking about, so what is it going to be like working in the stores, going into potentially what would have been a flu season, and how it is going to be so much more busier this year than it has any other year with the number of flu jabs. And then potentially there could be a vaccine that comes along for COVID. There's lots of work being done around that. So just thinking about some of those aspects as well. But what I would say is, I think the last 3 months have taught me that it's such a privilege to be a pharmacist, and it's such an honour to be able to be a part of the work that I've done with COVID-19 in these test centres, working with different people. So like training the army to go and do the work that they're doing with the mobile testing for those that are maybe in care homes, working with the government, working with teams within Boots, and all the other amazing people that we've worked with. And it's just about keeping all the skills that you learn as pharmacists, but taking them into the world that we're all working in, that's all new to us. So it has its challenges, but it's also been rewarding. And seeing when a patient comes through that drive-through, just thanking you for all the hard work that you've done, and really being grateful for everything that you're doing so they can get back to work safely. There's no greater honour than that. So it's been great.
Amazing. Thank you so much, Josie. I think that's, again, a really good insight into the things that you've been doing and the fantastic work that you've put into setting up these test sites. For people that might be curious, and this is myself included, what can people expect when they arrive to some of these test sites? If they are thinking, okay, I'm thinking I've got symptoms, I know there's a test site nearby, what sort of things would they experience by going along to something like this?
Yeah, so sure. So following the government guidelines, so if you feel that you've got any symptoms, then it's about logging on to the government website, just booking a slot, and it's really, really simple. Once you got your slot, you'll just turn up that that drive-through test centre in your car, and you'll register, you'll get a card, you'll go through to like what we call a cabin area, and will just perform the test on you and give you a card for when you get your results. So it's really quick, it's really easy, and it's really effortless to do it. So just if you do feel that you are having any symptoms, just book onto the government website to book your slot at a test centre, and then you literally just turn up in your car and go through the lane and get the test done. It doesn't take long at all to do the test on a patient. A couple of minutes, and then you get your results in the next couple of days. And it just helps those that are negative get back to work or wherever they need to. And if they unfortunately are positive, then they can take the relevant actions that they need to. But it's really simple and straightforward.
Okay, that's good. There's always the worry that it's going to be a much scarier process, I think. So it's nice to know that it is simple and it's going to be fairly sort of painless for patients that do want to go through that process. So no, thank you very much for that. I'm going to bring everybody else back in, just in case Ahmed or Simon or even Jay, because I know Jay's not had a chance to speak yet, if they want to sort of add anything at this stage. So let's bring everybody else in. There we go. Right. So does anybody have anything they want to add? I mean, again, I know we've not heard from Jay yet, and Ahmed, you've not said anything for a while. So this is sort of an opportunity for an open floor, I think, to just discuss any further.
I think what I would say is hopefully that has shown people who are watching, the opportunities that you can have as a pharmacist, and also the pharmacists are an integral part of the local community. The amount of work that Jyoti and Simon, and they're not alone in doing that. Like Simon said, pharmacies haven't been closed. They've been open. Those that were open every day of the week are still open every day of the week, and are all happy to help. So I suppose what it does for me from an academic perspective is it makes you think about what skills we need to teach the students, and it highlights the impact and the potential of all the transferable skills that you learn at university and taking them across to the real world.
Absolutely. I guess that segues quite nicely then for us to talk to Jay for a few minutes, if that's okay. So Jay, obviously, again, you've been working today, and I know that when we spoke briefly yesterday, you were working yesterday. So how have you found your experiences switching from, as you said before, the academia side actually into working and using some of those skills that you've been able to develop at university?
Yeah, definitely. It has been completely different. So when I first started, I was kind of balancing the two, kind of trying to keep on top of the academic side and still kind of help out, as well as kind of studying for what I was doing in a job. So I needed to learn a little bit more about the kind of OTC medications, a lot of the common ones, and what questions I need to ask, and just so that I can provide patients, I guess, quick and effective advice. So yeah, I guess it all kind of started weirdly from a tweet. So I put out a tweet, I guess the 16th. So it was 18th, when university was kind of suspended. We didn't really know what we were doing, but it was the correct decision. But I kind of felt that I was in a position to help. So the next day I went back home, and I started in a kind of small chain of pharmacies. And it's been enjoyable, and it's kind of a crazy time to have my first major experience in pharmacy. So I thought I would be kind of a good fit, because as opposed to getting someone and training them up completely, I didn't need to be trained kind of intensively by staff, so they could still get on with their jobs and I could help them with their jobs. And what I've seen is initially it swapped to straight dispensing. So all everyone was doing was dispensing. And then kind of people got to grips with that they couldn't have this kind of health advice from doctors or dentists. And it kind of ended up with lots of people coming in to pharmacy, wanting acute medication stuff just to get them by until maybe we can go back to dentists and doctors. But it's been kind of really rewarding dealing with those patients and being able to help them. Obviously, you don't get patients that are amazing all the time. There's lots of angry patients, but that's all part of it. And it's nice to see that everyone's kind of joined together and there's kind of a community spirit within the community pharmacy. I know we've got scouts doing our deliveries, so scout leaders doing our deliveries for us. We managed to get all patients that are over 70 and all of those that were told to shield. So we managed to put them on automatic delivery, which is something obviously that they were happy about. Yeah, so it's just been really nice to help them. And also, so what I've done is, so I've been involved in that in the pharmacy for myself, but also, so I helped set up a job matching platform that I think got 250 volunteers, or kind of pharmacy specific volunteers, into roles in which they could help out, become kind of relief workers, and help out, I guess, straight away. Kind of the same thing with me, kind of without that need for extra training. Yeah, so it's been it's been interesting, and it's definitely interesting to see how this will shape kind of my future, and to see what a pharmacy is like without the kind of clinical knowledge and clinical skills that you usually use in a pharmacy.
Fantastic. Thank you very much, Jay. I think that was, again, a really interesting insight into the things that you've sort of been involved in. Was it quite a shock when obviously university did close before the end of the year, going into that sort of working environment? And was there quite a quick transition for you?
Yeah, so it was the next day, I believe. So yeah, so it was definitely a quick transition. But I kind of thought, if I'm not going to be doing anything for university, and I want to be doing something, lots of people have been going crazy not being able to do anything. It's nice to be outside the house, I guess.
Yeah. Don't say that when your academics are here and they set coursework and things for you to do. There's definitely things you could be doing. But no, I think that's really, really interesting. And as I said, credit absolutely to yourself for getting stuck in, for helping out. And I think some of the comments that the private comments that we've had here saying you should absolutely be proud. You've been keeping the country going, as does everybody in the stream today, just making sure that we're keeping this country going, and absolute credit to all of you. So yeah, thank you very much, Jay. And I say we've got some questions that we're going to pitch into in a second, so it'd be good again just to get your insight from that perspective, particularly because you're a student, and how that sort of transition into the work has been able to support you with that.
Absolutely.
Let's bring everybody back in. So we've got Simon's back, we've got Jyoti, and then we've got Ahmed. Lovely stuff. Thank you very much. Does anybody, again, another particularly open floor for you guys, is there anything you want to add based on things that Jay has just mentioned, particularly from the perspective of a student?
I was just going to say that if you are thinking about doing pharmacy, as Jay said, and like echo what Simon said before, it's an absolutely great opportunity to get into it. There's so many things that you can do now, whether you want to go into community, hospital, academia, down other routes, prison pharmacy, independent prescribing. There's just an amazing things, and you really are at that pillar of community or hospital, and you're the one that they would go to and seek all that advice from. So we all feel proud to be in the professions that we are, and look at what we're doing, all different opportunities. So I would say just go for it. You'll have an amazing career.
Yeah, I'd echo that, Jyoti. I suppose if you want it, it's there for you. You know, if you want to do something different, then the opportunity is absolutely there. Because I'm sure, Jyoti, you know as well as I do, many pharmacists who are pharmacists but don't necessarily work in pharmacy. You know, there's other opportunities there for you as well. Obviously, we'd like you to stay in pharmacy, but you know, there's other career options there for you as well.
Oh yes, so many, as Simon said, and if we think about what's happening now, we've spoken mainly about community and hospital, but there's a whole industry out there that are that pharmacists will be involved in clinical trials and things, which would relate really great with the vaccines and COVID-19 as well. But there's you can do anything that you want within pharmacy.
Ahmed, do you have anything you want to sort of add, pitch in for there?
Yes, so no, I think the students, both students and staff, have been absolutely amazing over the last 3 months. I mean, Jay touched on his job matching platform. That's really helped students feel part of the community. It's helped community pharmacies at a time when they were in serious need of help. So, you know, going back, like you said, the 18th of March, at that point, it was very much we're shutting down on Monday, and no one knew what was coming. And then we had things like that Jay talked about in terms of people who were shielding elderly people who couldn't make it to the pharmacy, who didn't want to leave the house, and so the deliveries that have been organised, and it's not just pharmacists. You know, Jay alluded to the scouts that have been helping. It's the volunteers that have been helping as well deliver those medications. But students have, like I said, you know, in my introduction, have really found their community spirit over the last 3 months.
I think that's wonderful. I think it's wonderful to see. Jay, have you got other students, fellow students on the course that you've spoken to that have had sort of similar experiences to yourself in the time that they've had over COVID?
Yeah, lots of people on the course, lots of friends on the course they've been working in community pharmacies. They've just been doing the same kind of thing, helping out where they can. And obviously there's so many roles. It's just become like an easy option, a really good essential key worker kind of thing to do. So it's been nice to see kind of community and student spirit.
Absolutely. I say credit to all of you for the work that you've been doing. It's been absolutely fantastic. So, and I say hearing obviously Simon and Jyoti, your experiences in the pharmacy, and Jay as well, and obviously again Jyoti with the setting up of the test centres. I mean, these are things that are sort of happening, but and that people can take advantage of, and again just sort of keeping the country going at this stage. So it's been amazing to see. So thank you. Oh, go on, Ahmed. Sorry,
Ben. I was just going to say one of the things that people often have asked me is, why did you do pharmacy? And one of the things that I've always said to them is the job satisfaction. So when I worked in hospital, the job satisfaction you got was absolutely amazing. And that's been alluded to by Jay, Simon, and Jyoti. Just people saying thank you for what we class as our everyday job really makes it worthwhile.
Yeah. That's good. I think before we come on to some questions, I think it might be some good insight to get from everyone else is for students that are thinking of doing pharmacy, not even just because of COVID, but just in general, what would you sort of suggest to them, or what would you sort of say to them?
So my reasons for doing pharmacy, I loved people, I loved science and things, and I wanted to combine something that would give me the opportunity to give back to community. I pretty much knew that I wanted to do community pharmacy, but like Ahmed, it's so rewarding. I wanted to be that person that they came to, that they could get their medication advice from, but not just them, but see them through their whole, like their family, when they're coming in with different conditions as they grow through their lifespan. And I don't think there is any greater feeling than knowing that every single patient that you talk to, or every single conversation you have throughout the 8 hours or 9 hours of work that you're doing, you're making some kind of impact to that person's life and making such a difference to them. And I think even if you're in hospital, when you're doing that with industry or community, but that for me was that knowing that I'd be able to have a positive effect on someone and just make a difference.
Amazing.
Yeah, I'd echo that, Jyoti. I'd echo that. So I was like you. I did maths, physics, chemistry at A level. Didn't really know what I wanted to do, but I remember going to this career day and speaking to community pharmacy. And he said exactly what you said about talking to people is the key. I can talk to anybody for anything for however long I want to speak about, and that kind of recognition as well that you're doing a great job, and seeing the patients actually thank you very much, and that means so much to myself and my team, and I'm sure, Jay, you found that as well over the last few months, around people saying thank you for what you're doing. We've had so many chocolates and cakes and biscuits delivered. It's been great, and from our customers and our patients, and that's been really nice to have, actually. So yeah, if you're doing science-based A levels and not sure what to do, put pharmacy in your list for sure.
Amazing, that's good. Jay, again, casting your mind back to when you were looking at courses, what sort of steered you towards pharmacy? I know you've kind of mentioned it already.
Yeah. So my A levels were biology, chemistry, and physics. So I knew obviously I needed science, and also being able to help people directly, something that's quite rare, I guess, and being able to work in the community, being able to work on a high street or hospital, and being directly involved with patients. I think you said it's quite rewarding, and it's definitely a good option, I believe.
Good, excellent. Thank you very much. So yeah, go on, Ahmed. Sorry.
I mean, we've always got two community pharmacists with us today, but there are so many opportunities outside of community pharmacy as well. So there's hospital pharmacy, like Jyoti alluded to, industry, prison pharmacy. We have pharmacists in a lot of GP practices. So the opportunities are absolutely massive going forward, and they're only going to grow. So the opportunities post registration are absolutely massive. I think for me, knowing, and I've worked in hospital and community pharmacy, but knowing your patients on a first name basis, and them knowing you, that having that regular contact, and I've worked a regular Saturday, once or twice a month at the same place for the last 4 or 5 years, and people will come in because they know it's your Saturday, just to come in and say hello, and that makes it all worthwhile. And I think the big thing about De Montfort, so I studied at De Montfort, and then came back as a member of staff, and it's always been a very clinical course, more so now than ever 10 years ago. So I think for those thinking about applying, definitely do pharmacy. It's well worth it in the long run. And at De Montfort, you get as good an experience, and this is why we've got teacher practitioners. Like I said right at the beginning, in community pharmacy, hospital pharmacy, GP practice, they bring their own thing to teaching, and it means that you're getting the latest knowledge, the current knowledge about what's happening in the real world. It also means that we've got some very good network that we've built with some of the multiples, with the local hospitals, with GP practices. So the opportunities that you get for actual work out in placements and project work with GP practices, community pharmacies, hospital pharmacies is immense throughout the 4 years.
Yeah, and to echo what Ahmed is saying there, so if you're thinking about doing pharmacy, but more importantly thinking about doing pharmacy at De Montfort, I didn't study at De Montfort, I studied up north, and I moved here 6 years ago. And what I'd say about when I first came here, it was the staff, the students, everyone was really friendly. The course is really, really good. You get such an amazing experience, clinically, experience in like hospitals, communities, GPs. We've got great working relationships with the medics, the nurses. So thinking of from the student experience, it's absolutely brilliant. And I'm sure Jay will be able to tell you more about that. But in terms of what you're going to get to help you prepare for a career, it's brilliant. And thinking back to what Ahmed said, I wanted to know who my customers were on a name basis and that they come to you. And the great thing that I found about my career is that the patients will come in just to see you and get that advice from you because you've made that relationship with them. And I'm sure Simon will say exactly the same from his. But another great thing about pharmacy is that you're not stuck to one sector as well. So even if you start off in community, you can go into hospital. Ahmed's done both, and the flexibility and the options are amazing. And we've got a great team, not just of us guys on community, but our hospital teacher practitioners are amazing as well. So
amazing, wonderful stuff. I'm conscious of time, so I know we've only got a few minutes left. So am I okay to just stick some questions here over the last sort of 5 minutes or so? Is that all right?
Yeah, that'll be fine.
Thank you very much. So I think we've touched on this already ever so slightly, so this is quite a good, nice segue into this question. Somebody asked, and this was Ashika, she asked, what does the future of pharmacists and the scope of job availability in the UK look like?
Well, I think we've kind of covered that, haven't we, in a little way. You know, as everybody on this call me, Jay, you're starting your career, you know, pharmacy has changed a lot over the last five years or so, you know, and the opportunities there are enormous. So he's spoken about what Ahmed was saying about pharmacists and GP practices. That would have been unheard of 5 years ago. You know, the GPs would have said, no, we don't need pharmacists. We're quite happy. You know, now actually the NHS, as the pharmacists that's caught up with the trailblazers of that, have proven that actually pharmacists can do a great job in a GP practice. And now pretty much every kind of primary care or GP area will have a pharmacist with them or looking for one, and that's a very different career to take. But you know that is a way to expand your career. So, and the scope of job availability in the UK does vary from area to area. I'll be honest, you know, depends on where you're looking to work. If you want to work over where I am in Cambridgeshire, then there's loads of jobs available. If you want to work in areas of London, it's maybe not quite the same. But it does depend on where in the UK you're looking.
Okay, and in reflection on something like COVID-19, do you think that's a positive thing for the pharmacy job industry, or do you think that's, well, what do you think that impact is going to be?
Anybody else want to answer that?
It's certainly increased the focus of what pharmacists do. And you know, if we weren't busy enough already, it's certainly got busier. So no, I suppose it's one of the opportunities that comes with COVID-19.
Absolutely.
Yeah, and I agree. Yeah.
It's enhanced the kind of the profile of the profession for sure.
Absolutely. Yeah.
Sorry, and I think one of the great things about pharmacy, something to study. I've got a lot of friends because I'm kind of finishing my third year. So a lot of my friends from school are kind of graduating now, and they don't have a clue what they're going to do. But with pharmacy, it's kind of a set profile, and you can go through REL, and you can know that there is a future after.
There's a job there for you. Yeah,
there's definitely a job.
Yeah, it sounds like it, and I say the increased profile is definitely something to consider with that regard. So there you go. If you know you're looking for a job in pharmacy, move to Cambridge. It's always worth knowing. Okay, so another question then, and I'm going to steer this, I guess, a little bit towards Jay initially. But how are you balancing frontline and education at a time like this?
Yeah, so obviously I've finished my exams now, so I'm kind of relaxing from that academic side. But at the start, it was kind of very difficult. I had to, I guess, work 9 till 6 and then carry on, take a break, and then just try to understand a lot of what I've done. There was kind of, because it was March, there was a lot of the learning was already there and in place. But it's definitely a challenge, obviously, as everyone else you've heard already has got more than one job. It's kind of a balance between that, and obviously you need a life as well, but restrictions have kind of made that difficult anyway. So it's something to do. It's kept me busy and kept me kind of out my own head.
Yeah, absolutely. And going forward then, what do you think this is going to look like for students that are going through pharmacy, balancing the sort of support and the work profile that they're doing and the education side? What do you think that's going to look like? And again, this go to Ahmed or Jyoti, whoever.
So it's one of the challenges. I mean, just adding on to what Jay said, you know, we were happy for our students to help out in the community, but the proviso was that you have to remember that you've got exams coming up. What you didn't want to do is spend 40 hours in pharmacy not have time to do your exams, fail your exams, and find that you've got the whole of next year to carry on working because you're not on the pharmacy course, and that's not what we wanted. So we've been making sure that people are aware of trying to balance that working with education. Like Jay said, at the moment exams are now finished, so by all means, and there'll be lots of students out there now, either starting their pre-reg soon, hopefully, or if you're a first, second, or a third year, plenty of time to do that work. So I think over the summer, definitely there'll be more and more people out there, and it's valuable experience. You can't get any better experience than actually being out there in the real world. So that frontline experience is absolutely brilliant for them. It's vital. We can quite often, over the years, you can see the difference between students who have had pharmacy experiences, during the summer, either before they start or in the first year or second year. Even if it's just getting used to drug names and looking drug names up, or knowing how pharmacy works, they're a lot more engaged. So we've said that for years. Get yourself as much experience as you can. This is a perfect opportunity to do that.
Absolutely. Okay, I'll make it the last couple of questions then, since I am conscious of time. But in general, and this question, I guess, to all of you is what is teaching in some capacity, as best as you can at the minute, what is teaching going to look like when it comes to sort of September for something like pharmacy? I know we haven't got all the answers yet.
That's the $1 million question, yeah. So obviously there are certain things that we can quite easily convert to blended learning and to online learning, and then you've got more of the practical aspects, laboratories, the chemistry kind of things, the lab work, the placements, and they're all the things that we're discussing in the background. If we take placements, I had a discussion with the hospital yesterday about placements, and everyone realizes the importance of placements, and that importance has grown over the last 4 or 5 years. It's trying to find that balance between the risk that students might take going to a hospital in the middle of December, when potentially it's flu season, we may get a second spike, versus what they're going to learn out of that. So it's trying to find out, can we move them to the second term so that we can get some placements, but bring some of that into the online learning. Doctors, pharmacists, everyone has had to make some changes over the last few months, and we found lots more doing online consultations. So again, Simon alluded to that. We're going to have to update some of our consultation skills and communication skills that we teach our students, because when we were, like you saw yesterday, when we were practicing for this, Jay was at work in a mask, and that's the new norm. So actually trying to speak to patients through a mask, through a perspex barrier, or online or over the phone is not as good as we had pre-March. But we have to equip our students with those skills. So I think it's finding opportunities to give them more transferable skills, and then trying to do the best for our students with not putting ourselves at risk as staff, and not putting the students at risk as well. All of that is ultimately dependent on what happens with COVID-19 and what happens with government guidelines.
Absolutely. Okay, I think what we'll do is we'll end the stream there, because as I say, I appreciate that. I know that Jay, you've had a busy day anyway, and I know Simon, you're in the middle of your working day as it is, and we've all got things that we need to be doing. So I'm gonna end the stream there, but I just want to say thank you so much for giving us so much insight there into what has essentially been your world for the last few months. And I just want to thank you from everybody for like I say, keeping this country going and for doing the things that you've been doing. I say, Jay, for putting yourself out there and using some of the skills that you've learned to work in that pharmacy, to Simon and keeping the pharmacies going, and to Jyoti to keeping those COVID centres and building up those test centres, and to Ahmed, looking after those students that for that period towards the end of term, it is really, really, it was really uncertain for a while. So I know there's going to be a lot of thanks going around. So thank you so much from me here on the live stream for doing all the things that you do, and for talking to some of our students today about all the things that you've been getting up to. Thank you very much for that.
Thank you.
Thank you.
Thanks very much.
And thank you to all of you that were watching in the comments. What I'm going to do now is I'm going to pop a couple of links in the comments for you to access. So if you'd like to find out more about pharmacy, we've got an open day coming up on the 4th of July. What I'll do is I'll pop the link in the comments there. So if you do want to book onto the open day, you may get the opportunity to speak to some more of our fantastic pharmacy students and teachers and academics. So if you do want to find out more about that and more about the opportunities that DMU has to offer, I will pop that link in the comments. But other than that, have a lovely rest of your afternoon. Stay safe, and we will see you at the next live stream. Take care, everyone.
Thanks.
Bye.